Good afternoon. I'm Eileen Doherty, and I'm the director of the Colorado Gerontological Society. I think in the interest of time, we'll go ahead and get started. There were quite a few more people who signed up, but we'll just admit them as they are able to join us. So our Wednesday Lunch and Learn this afternoon is specifically going to be on prescription drug benefits. We'll look at insulin, vaccines, formulary changes, tiers, basic kind of what you need to know, and then take a quick look, time providing, as well at the Medicare website, just to help and make sure that everyone kind of has a sense about how to manage that. So basically, as I said, we're going to look at formularies, insulin, vaccines, plan finder, just the basic stuff related to it. Most of us probably feel like this poor gentleman. I've used his picture a number of times over the last couple of years, but I just feel like it's a very important confusion that many of us feel about Medicare. As I often do, I want to stress that Medicare has parts A, B, C, and D, and then companies, insurance companies, which are Medicare Advantage companies, prescription drug companies, and Medicare supplements, they all have plans. And Medicare Advantage plans basically are Part C. Prescription drug plans are Part D. By way of a quick overview, Part A covers hospital insurance, care in a skilled rehab facility, hospice, and some home care. Part B covers doctors and specialists, outpatient care, such as MRIs, ambulances, emergency rooms, labs, etc., labs, x-rays, medical supplies like oxygen and wheelchairs, and preventive services like mammograms, colonoscopies. Those two together, Medicare Part A and Part B in the green, are known as Original Medicare. Then we have Part C, which is the Medicare Advantage, covers everything that's in Original Medicare, plus sometimes offers additional services like dental care or whatever. And then Part D is prescription drug benefits. Just so we kind of know what we're working with for 2024, Part A has a deductible of $1,632 per benefit period. That frequently is paid by a Medicare supplement, or if you are in a Part D plan, you will usually pay a per day charge, which is a standard or a benefit that the Medicare Advantage company has negotiated with Medicare. The monthly premium for Part A is free to most people. People who have 30 to 40 quarters pay $278. People who have less than 30 quarters pay $505 a month. The copay for skilled nursing for days 1 through 20 is 0. Days 21 through 100 is $204. The Part B deductible for 2024 is going to go to $240. The monthly premium for Part B is $174.90. Medicare pays 80% of the charges, and you are responsible for 20%. Again, frequently paid by a Medicare supplement or by Medicaid. If you're in a Medicare Advantage, your copays look a little different. The deductibles on the Part C plans vary by plan. Most of them have a zero premium program. There are 65 plans offered by 9 companies, I think it is, in Colorado this year. Most of them do have a zero premium program. The copays for things like hospital care is usually like a flat fee of, say, $325 per day. And for days 21 through 100, usually it's $204 per day. And that is out of pocket. There is no insurance coverage for that. The Medicare Advantage plans also have a flat copay for some services. For some services, they pay an amount, and then you will have the 20% out of pocket. The Part D, then, the deductible varies. We have 21 plans sold by 8 companies in Colorado. There is one plan that is very low cost. And again, what's on the tiers varies depending on the plan. So with that, we're going to switch now to talking a little bit about prescription drugs. So there are 2 ways basically to enroll in a Part B plan. Either you enroll through a Part C Medicare Advantage plan, or which has a Part D embedded in it. And this is like an HMO, a PPO, an I-SNP, a C-SNP, a D-SNP. Or you can enroll in a standalone prescription drug program. If you're new to Medicare and you opt not to enroll in Part D, or you decided not to enroll for some reason or other than the fact that you had employer group health coverage, the penalty is 1% per month for every month that you are not enrolled. Under Medicare Part D, then your premiums, if it does have if your plan that you choose has a premium, you can have it deducted from your Social Security check. And we are now what we call in open enrollment for the annual enrollment period, or AEP. And that will go to December 7th, 2023, and coverage starts January 1, 2024. So the standard Part D benefit this year, the annual deductible has gone up to $545. Some plans have a lower deductible, and if you are in a Part C plan or some D plans, they may decide to waive the deductible, so you may or may not have to pay it. The way that the annual deductible works is that you are responsible for paying 100% of the cost of the drug, and the pharmacy or the plan pays 0 when you are in the annual deductible level. The second level, then, once you have reached the 545 or whatever the deductible is, you pay 25% for all basically brand name or generics, which the cost of the out of pocket to you in this level is $1,257 is what you pay when you are in the initial coverage level. And when the cost of the drugs and what you pay when the prescription drug plan gets to $5,030, then you move into the third level, which is the donut hole or the coverage gap. And again, Congress changed this a couple years ago. So now you continue to pay 25% of the cost of the drugs until the cost that you put out, as well as the prescription drug puts together, reaches $8,000. So we have basically the 545, which is the deductible, the 1257, which is the 25% in the initial coverage, and the 1497 in the coverage gap or the donut hole, bringing you to $3,300 out of pocket. The really big thing that you all need to know is that this fourth level, which was known as catastrophic coverage, is no longer requiring any type of an out-of-pocket payment from the beneficiary. it still requires a payment from Medicare, and it requires a payment from the prescription drug plan. But once you basically reach $8,000 in terms of what you pay and what the prescription drug plan pays, you no longer have any copay at all. The next thing we want to look at is the formulary. And the formulary, basically, these are the prescription drugs that are covered by the plan. The plans are allowed to change prescription drug coverage every single year. They can also change coverage every 60 days. They do have to give you notice. And they can change their formulary every 2 weeks. Not all drugs in the that are approved by the Federal Drug Administration are covered by every company. So tier 1 tend to be what they call preferred generic drugs. Oftentimes those are either free or $1 or $2. The tier 2 generics are often also $1 or $2, usually relatively cheap. When you get to tier 3, though, this is where we have seen some pretty significant changes this year. So this is often known as the preferred brand level, and that can be as high as 27% of the cost of the drug. In previous years, we have seen more where when you were in tier 3, you paid a standard copay of like $15 or $20 or whatever. A tier 4 then, and tier 3, 4, and 5, all of these tiers may include insulin. It's important to know that insulin is $35 per month per script. So if you need 3 vials of the same drug, you pay $135 copay. If you need 2 different types of insulin, then you would pay the $35 for each type of insulin. And it could be, according to the information that I looked at, it could be on a tier 3, it could be a tier 4, or it could be a tier 5 drug. Actually, that doesn't really matter because the only amount that you are required to pay is the $35. The tier 4 then, this one has always been higher, but usually not as high as 50%. So what we're seeing is if you get a tier 3 drug, you're looking at 25% of the total cost. If you get a tier 4 drug, you get 50% of the cost. Now, what some of the companies have done now is they have broken out the tier 5 and the tier 6. So tier 5 becomes the specialty drugs. So these could be like the cancer drugs, or it could be like antidepressants or something. And then tier 6, these could be also some types of select drugs that are not included. So on tier 5, we're seeing, again, very similar to the tier 3, 27, 28, 29% of the cost. So Medicare required way back when Part D came into law that there were 6 protected classes. And what that means is that in every prescription drug that is approved by the Federal Drug Administration that is in these 6 different classes is required to be covered. So immunosuppressants, antidepressants, antipsychotics, convulsants, retrovirals, and antineoplastics. All of those drugs have to be covered regardless of whether or not the there are more than one or there's a generic available. The name brands also have to be covered. So the next thing we want to look at momentarily is the utilization management, or limitations, or sometimes what we call restrictions. So there are three big restrictions, if you will. One is prior authorization. And what that means is that the plan has to approve the prescription drug before they will cover it. There are some new guidelines around that, and many of the companies have started to relax that a bit, realizing that it costs them more money to actually put these prior authorizations on and staff up than it is to approve some of the drugs. The next one is step therapy, and this is where the plan requires that you try either similar or generic or other low-cost medications in the same category before they approve payment of the prescription your physician has requested. Excuse me. There are also new requirements if you are in a Medicare Advantage plan that certain types of drugs for certain conditions, Medicare Advantage is not allowed to impose step therapy. So if you are in a Part C or a Medicare Advantage plan and they talk to you about step therapy, be sure to ask what the exclusions are. And then the last one is quantity limits. And I frequently describe this as this is the number of pills, if you will, that the company will pay for in a month. So a 30, 60, 90 pills per month, those are pretty standard prescriptions. But when you start getting 120, 150, 160 pills per month, that starts to look like it's a lot of pills, and you may very well be subject to quantity limits. Out-of-pocket expenses for the standalone Part D then are you have the premiums, and one company actually is offering a zero premium all the way up to about $129. The standard deductible is $545. The co-pays and co-insurance are what we just discussed, and I guess I forgot to change this number from 7,400 to 8,000. And then diabetics, we just talked about that as well. So insulin, as I said, it's $35 per month per vial and or insulin pen per script. And not all plans participate. So this is the most important thing if you are a diabetic, is to make absolutely sure that the company that you select and the plan that you select will in fact give you the $35 per month per vial. Otherwise, you will end up paying the full amount, and that can be pretty expensive. Another thing that the Medicare Part D and or B is that vaccines no longer require a copay. Some vaccines like flu, pneumonia, and hepatitis B are Part B vaccines, and you can get them at your doctor's office, a clinic, or your pharmacy. It's important to make sure that you get these where, in fact, it says here, because otherwise you will end up paying for the immunization or the vaccine. The Part D, which are shingles, Tdap, COVID-19, and RSV, you always, always, always want to get them at the pharmacy, because the pharmacy is going to be a Part D provider, and they can bill your Medicare Part D plan. Now, not all providers, not all pharmacies participate with all plans. So again, you need to make sure that your plan that you select is available at the pharmacy of your choice. Part B, the other thing I should probably mention here is that your diabetic supplies you can get at some pharmacies if they are a Part B provider, and King Soopers and Safeway and CVS are not. If you go to Walgreens, they are a Part B, as in boy, as well as D, as in dog provider, and they can bill, and then you don't have to pay out of pocket. So here's just the range of what we're seeing. WellCare has the zero premium plan this year, with Anthem being a little over $130, with the average being $71. This is the list of the companies that are offering plans in Colorado this year. So you will need to register with one of them, or if you end up being satisfied with what you have, you can stay there. So the next thing I want to do is I want to look at the Plan Finder. This you can get at Medicare.gov. And this is what Medicare's I'm not sure why it's not going in the PowerPoint. Can you see that? Can you see the man in the center that says it's open enrollment time? Okay.
Yes.
Yes.
Okay, thank you. So this is what Medicare's website looks like. What we are most concerned about is Find Health and Drug Plans. And for today, we are just going to continue without having an account. So I will just use my zip code, which is 80220. We want 2024 information. For this search, we're only going to do the Medicare drug plan. On this particular search, we are not going to have Medicaid. We're not going to have SSI. We're not going to be on the low income programs. So we're going to basically check I don't get help from any of these programs. So now it asks us to begin to do the search about what our prescriptions would cost. So what we are going to do is we are just going to put a couple of drugs in here. So the first one we're going to put in is albuterol, and we're going to add that drug. It's going to ask us whether we want, which type we want. We're just going to accept the first one, and we get one of those every month. Although my experience is that a lot of times people who get those use more than one a month. We're going to tell it to add that. The second thing we're going to do then is we're going to add insulin. So we'll just do the, so we'll just do Lispro, and this looks like it's one of those pen injections. So maybe rather than doing that, we should do the solution and get one each month. And then we're going to add, whoops, back. So I also want to add levothyroxine. And we're going to do one a day. And I want to add another drug called atorvastatin. So I'm going to add that drug, and I'm just going to accept the basic again. So we're going to add that. So now we've got 4 drugs. We've got the albuterol, which we take 1 of. We've got atorvastatin, which we take 1 a day, insulin, which we're going to get 1 of, and levothyroxine, which we're going to get 1 every day. So then we click and say we're done adding drugs. So now I could either specify here which pharmacy I want, or I can ask it to find a pharmacy, and I can tell it to find them within 1 mile of my house or more. So I can go to 5, 10, or 25. I will stay with 1 mile. So now I can add mail order if I want. And then I could do Safeway. I can do King Soopers. I can do Walgreens. I can do up to 5. But those will fit for me. That'll be enough. So now I'm done adding pharmacies. So now it's going to start my search, okay? And so my search here comes up and tells me that of the 21 drug plans, 10 meet kind of what my needs are. It's also sorted by lowest drug plus premium cost over here so that I can get the cheapest monthly out of pocket. So what this is telling me is that my monthly premium would be $20. My out-of-pocket cost for retail would be $7.98, and my mail order would be $280, and I would have a $280 drug deductible. So this is one of those companies that doesn't necessarily have that. Now, I want you to look at these numbers. And then the second one it gave me was WellCare, and it has a 0 premium. But again, it's telling me the retail pharmacy is going to be $800 with a $400 deductible and almost $800 with a mail order. So those are approximately the same, if you will. So I may want to consider that one. The next one that we'll look at, and we'll just do 3 of these. You can keep going and look at all of them, is a Cigna Saver RX. Sometimes I pay attention to the star rating. Has a $10 monthly premium. And so the premium plus the cost, the retail is $936, mail order $945 with a $545 out-of-pocket expense or deductible. So I can ask it to compare all 3 of these. Actually, before I do that, I'm going to look at I'm going to show you something different. So then I'm going to look at plan details here. So it tells me my premium is going to be $20.10 each month, and my estimated drug costs are going to be $556. Okay. And my drug deductible is going to be $280. If I go to King Soopers, Safeway, or mail order, I'm going to be in network. If I go to Walgreens, I'm going to be out of network. Okay. Now, so in addition to checking the tiers, we also want to make sure that the pharmacy that we go to. So the albuterol is basically going to be the most, or the $268, $204, $214. If I do mail order, the atorvastatin is basically free. The insulin is still going to be my most expensive one, $35 a month for my 1 script. The levothyroxine, if I go to King Soopers or Safeway, is 0. If I go to Walgreens, it's going to be $182. So King Soopers, my total drug 621, Safeway 556, mail order 557 or 567. If I do Walgreens, going to be way up over $3,000. So then this adds in, if you will, the premium. So this is the drug plus the premium costs, and tells me that I won't meet my deductible if I go with these. I'll only get to that $200 and some. Here I'm going to meet it almost right away. This then breaks out my monthly costs. Okay. So then I can view that and where they go or where they are. If I add or click on this view more details, here's where I start to get additional information. So now I see what tier it's on. So remember the preferred generic, preferred brand, non-preferred brand, specialty tiers. So this tells me if any of my drugs that I have put in will be in those categories. Here's that initial coverage phase. Here's the second level. Here's where I'm responsible for everything, unless it's a generic, usually I said. Coverage gap, here is level 2, and catastrophic is the 4th level. Basically, this is telling me I'm never going to get to the donut hole, okay? So then it takes a look at my drugs. So the albuterol is a tier 3 drug, and it does have quantity limits. But I'm not going to worry about it because I only put in 1. Now, if I had more than 1, maybe I'd be concerned. There's no prior authorization required for any of them, and there's no step therapy, meaning I don't have to use a lesser drug before it's covered. But then the atorvastatin is a tier 1 drug, but even it is on quantity limits. But again, I'm only taking 1 a day, so I'm really not too worried about it, okay? But look here, this particular plan is not covered, insulin is not covered here, it says, okay? But it did tell us that it was $35 per vial, so they are meeting the national government required standard. This just tells us what our drugs are, and then tells us what the star ratings are. The star ratings we get by people like you and myself, responding to various kinds of surveys. Okay. So that's what happens in SilverScript. You can do a similar type of review then for all of the different ones that come up. If you want to enroll yourself, you're certainly able to hit this button here, and it will walk you through the process then for how to join. And you can join from here. So now it's time, if you will, to make decisions about what is being, what coverage you have and what is being covered. So you can enroll either, as I just said, on the Plan Finder by clicking on that button, or you can call 1-800-Medicare and they will help you, or you can call an agent and the agents will help you. The biggest thing that you need to enroll is you will need your Medicare card, because on your Medicare card, one of the questions will be, what month did you become eligible for Medicare Part A and year, and what month and year did you become eligible for Part B? That is one of the verifications, if you will, that Medicare does to make sure that you are who you said you are. And then you will need your mailing address because, again, they're going to verify that with your existing account. So this is just kind of a review, if you will, if you're going to enroll online, is that you click that enroll box. A pop-up box comes up that says join the plan, and then you can go through the enrollment process, and it will just ask you these different kinds of questions, like what is your Medicare number? What is your ID number, your contact information, the options that you want, payment options. So if you want the premium taken out of your Social Security check, if you want to send a coupon every month with a check, if you want to do a bank draw, whatever makes sense, you sign and agree, and you review and submit if you do it yourself. It's important to keep and print, or at least write down, the confirmation number that you get when you hit submit. If there's any problems with your coverage getting transferred, or you're continuing with your current coverage, if there's any problems, that confirmation number will tell us when you enrolled, so that we have a protected filing date. If you change companies, you're going to know hopefully within 1 to 2 weeks, because the new company that you signed up with should start sending you information, such as a welcome to the new company. Similarly, the company, if you're dropping one, will send you a letter indicating that they have information from Medicare, indicating that you are dropping their company. And then you should get like a new card and other information. So it should happen pretty quickly if you were successful in registering online. The other thing is that if you do wait until December the 7th, it may become really important to keep that confirmation number, because sometimes things do get tied up in the holiday mail. If you want to stay after you've done your research with the current prescription drug plan that you had, you simply do nothing. They will just continue your enrollment. You won't get a new card. You won't get anything. It just continues on. Now, some people may need assistance paying for Medicare Part B and D, or we're always looking for how can we save money in Medicare with our prescription drug costs. So there is the Medicare Savings Program, and that will help to pay your Part B deductibles and copays. And some people who are really low income, it will also pay the Part A and B deductibles, as well as the copays and the coinsurance. And then you enroll for that at the County Department of Human Services. If you are a single individual, your income should be $1,660 or less. If you are a couple, it should be $2,239. And your resources, meaning money in the bank, could be a term life insurance, or a whole life insurance policy. Doesn't count your car, doesn't count your house. Your resources should be less than $9,900, and for a couple, $15,600. Now, Medicare also made a major change in the Extra Help program this year. So even if you are not eligible for Medicare help with Medicare Part B, many more people are eligible with help for Medicare Part D. So your monthly income for Part D, they have increased it. Some people were eligible for full extra help and some for partial. Partial extra help has basically been eliminated. So the full help limit on the income side is $21,870. A couple is $29,850. And for resources, it's increased to $16,600 for a single person and $33,240 for a couple. You sign up for this benefit at Social Security. You use your My Social Security account. If you haven't already set one of those up, then you should set one up, and then you can go ahead and enroll in this. And I expect that about 40% of Coloradans will be eligible for extra help. About 40,000 Coloradans live on Social Security only, and that same group has relatively a small amount of money that they have been able to save over the years. So this is kind of a timeline that we had from last year. And the two things that Medicare has done or started to implement is they are implementing the 5% catastrophic coverage. So they're eliminating that. You no longer have to pay if you get to catastrophic. And then, as I just said, it expands the low-income subsidy or extra help. Another thing that Medicare was instructed to do is to begin to negotiate with the pharma companies. So this is a list of the prescription drugs that Medicare has started to negotiate with the different companies. There was a lot of pushback saying that the companies that manufacture these drugs would not agree to negotiate those prices with Medicare. However, three of them, Pfizer and Merck, and I forget what the third one is, have already agreed. And so that's not really something that we need to have too much concern about, is whether or not your drug will be available, because the big companies have decided they are going to play ball. This one is really important. This is now a new thing that says that your pharmacist can tell you if your Part D copayment is greater than if you just purchased the prescription drug outright. So let's say you go to the counter, and for your atorvastatin, they would like to have a $20 copay. But if you just buy it without your Part D plan, you would only pay $5 because it's generic. So your pharmacist can now, starting January 1, tell you if your prescription is going to be cheaper if you don't use your Part D plan. So I would highly recommend that all of you get into the habit of asking if, in fact, the Part D plan is giving you the best price. So that concludes my remarks specifically related to Medicare Part D. The next slide gives you a little bit of information about what we at the Society can help you with. And basically, we can help you with counseling in English or Spanish for enrollment questions for Medicare supplements versus Medicare Advantage plans. We can help you put your drugs into the plan finder and support you through the enrollment process should you request. We also can refer you to health insurance agents that we work with who could help you sign up for a Part D plan or a Medicare prescription or a Medicare supplement. We are partnering with the University of Colorado. So if you would like a clinical review of your medications and your vaccines, please put that in the chat and I'll be happy to capture your name. We will post this presentation on our YouTube channel as well as other presentations, both throughout the Medicare season, as well as other topics that we have done Zoom meetings on. And there is a lot of information at our website as well. Our telephone numbers, if you wish to call, are 303-333-3487. Our toll-free number, if you are outside of Denver, is 1-855-293-6911. Our Spanish line is 1-855-880-4777. In our current programming for CGS, we do try to pay attention to the social determinants of health, trying to bring you programming that meets some of those deficits, if you will, that many people experience in terms of having equitable health. So we do have a vision, hearing, and dental program where we can pay for eyeglasses, hearing aids, and dental care. We have a mental health program with telephone buddies. So we have telephone buddies, individuals, volunteers who call older adults once or twice a week to check in on them and make sure that they are okay. We just got refunded for our advanced care planning series. So we'll be doing those sessions again starting in November. And then we won't do a December one, but we'll do all throughout 2024. If you are in the Denver area and either would like a Christmas basket, if you're low income and going to be home alone without any family or friends visiting, you can certainly apply for a telephone basket or a holiday basket. If you would like to deliver, we're still looking for individuals to deliver as well. We can help with Medicare and Medicaid counseling. We can help with housing through our housing and home care locator, and we can do benefits counseling. On the education and advocacy side, we'll be doing our Salute to Seniors again in May of 2024. We have posted some work on multi-generational family housing and supports and services on our website. We have produced some collateral materials as well, and we'll be doing some sessions related to that. Our guidebook is going to be available in libraries relatively soon. Medicare Monday, we are doing both in-person and virtual sessions, so check our website for the schedule. And then we've also do quite a bit of work in terms of public policy and advocacy. If you're not on our newsletter mailing list and you would like to be, you can also put your name in the chat and I'll add your name to that list. We are especially proud, if you will, of our Latino Services Division, where we have a Spanish-speaking individual on our staff who provides those services around Medicare benefits. She can do general counseling, teach us some classes in Spanish. So we're absolutely delighted that she is with us. And that concludes all of my remarks for today.